currently being hailed as the world's first SCI cell transplant trial. Griffith University, Queensland, Australia, has launched a Phase 1/2 clinical trial, implanting patients' own specialized nasal support cells that are seated in a 3D nerve bridge scaffold and transplanted into chronic spinal cord injury lesions. It's the first trial globally to combine an engineered OEC tissue transplant with intensive rehabilitation in chronic SCI. Hi, I'm your host Mike. Welcome to Beyond Paralysis channel. I've spoke a few times now on how the research view on a cure for SCI has shifted from finding a magic bullet like stem cells to knowing it's going to take a combination treatment to actually get us there. So today, we'll take a deep dive into the world's first combination trial, taking place all the way over in Queensland, Australia, where we hope to find out if our sense of smell really does hold the answer to fixing our spinal cord injuries. And as always, please do like and subscribe to let me know if you get value from this video. Together, we can make a difference. Okay, that said, let's dive in. Nerve bridges and OECs, what actually are they, and why they help SCI? Olfactory Ensheathing Cells, or OECs, are part of the nervous system high up our nose that acts to give us our sense of smell, designed to sense chemicals in the air, detecting all the scents and odors out there. However, because these nerves are directly exposed to the outside world, they are bombarded with airborne toxins, viruses, bacteria, and physical trauma from drying out in the air to the odd, harsh nose pick. Because of the constant damage, the olfactory system has evolved to be a master of nerve repair. It is one of the only parts of the adult nervous system that continually regenerates, and OECs within it are a big part of how it does this. OECs are not nerves themselves. Rather, they function in the olfactory system to guide new sensory neurons from the nasal lining into the brain every day. You may have heard of myelin from other research trials, as these cells hold a lot of repair cues. Myelin is the ensheathing or insulation layer around nerves that allows for fast nerve conduction. Different forms of these ensheathing cells are present depending on where in the body they are located. In the brain and spinal cord, it's oligodendrocytes that create the myelin. In the bodily nerves, it's Schwann cells doing the job, and in the nose, it's olfactory ensheathing cells, or OECs. These cells also secrete molecules that promote axon growth, clearing away scar debris and remyelination, enabling continual regeneration of olfactory neurons in the nose. Unlike many stem cell treatments, the Griffith team isn't just injecting these cells as a liquid soup, which is what most older trials did. They are taking your own OECs and using a technique called liquid marbles to clump them together into a solid 3D rope-type bridge, a kind of living nerve bridge. Normally, in your nose, OECs form a kind of tunnel to guide new sensory neurons into the brain. With the engineered nerve bridge, the researchers are essentially recreating that tunnel and physically placing it into the spinal cord gap, where it then releases growth factors, clears away scar debris, and, most importantly, it provides a physical track for your spinal nerves to cross the injury site, something a liquid injection of stem cells just can't do. We already have preclinical studies showing OEC transplants can remyelinate axons and restore some function in animal SCI models. Then, long-term intensive exercise therapy is included because activity-dependent plasticity is critical. Over the last 2 decades, research has shown that the spinal cord, even when damaged, has great potential for plasticity, which means that nerve reorganization can occur, forming new connections that work around the damage to create alternative pathways. But in order to stimulate this plasticity to happen, patterns of repeated physical activity are needed, namely rehab. And it's the aim in this trial that OECs will guide sprouting connections formed via the nerve bridge, and these connections will be strengthened and integrated into functional pathways through the action of rehab. Okay, so we now have a complete understanding of what the research is and how it works. Let's now see where we are with the treatments being trialed in humans, with a quick look into how they got here. In 2017, Professor Alan McKay-Sim, Australian of the Year for his stem cell and OEC work, and collaborators refined OEC culture methods and addressing past challenges like cell purity. Around this time, St. John's Lab develops a technique for growing OECs in 3D spheroid marbles, aiming for a scaffold-free cell graft. Then, in 2018/19, the Perry Cross Spinal Research partners with Griffith University, securing major donations and Queensland state support. The initiative is dubbed the Spinal Injury Project, aiming to take OEC nerve bridges to clinical trial. In 2021, the team publishes a detailed position reviewing all prior OEC clinical trials and outlining best practices for a successful trial design. By late 2022, the team has developed a protocol to grow patient-derived OECs into approximately 10 millimeters long living bridges that remain viable for implantation. Very futuristic-sounding stuff? In early January 2024, after years of safety and toxicology testing and ethics review, the trial wins Human Research Ethics Committee approval in Australia. The study is registered on the Australian-New Zealand Clinical Trials Registry on the 3rd of April 2024. Now, this is the part we all look for, the official inclusion criteria. Who actually gets a shot? The registry confirmed they are recruiting 30 participants with chronic traumatic injuries. That means you have to be at least 4 months post-injury, with no upper limit on how long you've been in the chair. They are specifically looking for people with clinically complete or severe motor sensory loss, injuries who have basically plateaued. Crucially, for this safety phase, they are focusing on paraplegics and low cervical tetraplegics. I believe C4 or above are excluded for now due to surgical safety risks regarding breathing, but for the thoracic and low cervical chronic community, this is built for you. In August 2025, Griffith University officially announces that the world-first trial has commenced, calling it 3 decades in the making since the initial discovery of OECs, striking a hopeful tone that this could challenge the notion that recovery is impossible in chronic paralysis. It emphasizes that primary outcomes are safety, but the team will also measure changes in function. By the end of 2025, a small number of participants have undergone the OEC transplantation surgery and are in the long, post-surgery rehabilitation phase. The control group participants, who do rehab only, mirror these timelines minus the surgical events. The trial remains blinded. Outcome assessors do not know who got the cell transplant to preserve objectivity. Participants and clinicians remain cautiously optimistic as they progress through therapy. Any noticeable improvements are closely guarded until data lock. The research team does engage with the SCI community via webinars, such as the November 19, 2025 Hope, Science, and Breakthroughs webinar, led by Professor St. John, to provide general updates and manage expectations. Enrollment is expected to continue into 2026 to reach the full sample of 30 participants. If interim safety data are positive and no red flags emerge, the team may seek approval to expand to a Phase 2 trial. However, given the pioneering nature, they will likely finish this controlled study first. Final results, with all participants' 48-week outcomes, are anticipated to be analyzed in 2028, with publication in a peer-reviewed journal thereafter. Now, I know what you're thinking. I don't want to wait until 2028 to know if this works, unless I was the only one who thought this. And honestly, you probably won't have to. While the scientific papers take years, the whisper network moves a lot faster. Here is my prediction on when we'll see the first signs of life. Keep your eyes peeled in late March and probably again in October 2026. This is when the Perry Cross Foundation, the major funders, hold their big fundraising gala. In trials like this, that is the prime moment they bring participant data to show progress and excite potential donors. So we aren't looking for a peer-reviewed paper yet. We are looking for that cell phone video and news article of patient updates, hopefully with promising insights fairly soon. There you have it, the full breakdown on Australia's world-first combination trial. With this one, we're in the wait-and-see category. We don't have any sensationalized news yet of SCI cure, paralyzed person is now walking, that the media like to produce whenever we get a trial. And as a reality check, I don't expect to see anyone going from complete paralysis to walking. However, now we are moving from trying to treat participants with a one-shot magic bullet to using combination treatment of new cells, growth factors, inflammation reducers, nerve bridges, and intensive rehab. I am expecting to see participants gain more sensation and function than what we have previously. I included just some of the long history in this research to show just how far we've had to come to get here. And I see this in most of the research I look into, that it's been non-stop 20 to 30 years plus of dedicated people working in the research cycle, of idea to research, trials that fail, trials that work, trials in animals that work, but then fail in humans, over and over again, building up all this information, good or bad. It has enabled a wealth of understanding to build. We are uncovering the mysteries of the unbelievably complex processes of our nervous system. And hopefully, the results of this trial takes us one giant leap closer. Thank you for your time. If you found this deep dive into the research useful, please hit that like and subscribe button. It lets me know that you got something out of my research, and I'll continue to keep us updated on all the latest news. All real information without the false hope. And please, feel free to just drop a hi or comment about your own journey in the section below. We're very small right now, but I aim to grow this community together until we reach that goal. I've been your host, Mike. Keep well, stay hopeful, and I'll see you in the next one.